Hi, my name's Ann Delisle, and I want to thank Senator Brown for bringing this piece of legislation to you, the Senate. And I want to thank you for taking the time to listen to me. I've been a nurse 22 years now. I've mostly worked in the hospital setting. I have worked in offices as well in other areas, but I want to really focus on the hospital setting now as I speak to you about the demands that are on the nurses. The patients that are in the hospital these days are really sick. They're way sicker than they used to be. There are very large care plans in place for each patient. As we've seen this shift go from fee-for-service to quality-based reimbursement in the hospital, I've seen some great improvements on the application of evidence-based care for these patients. It's really, in a lot of ways, improved what we do. You can argue that both ways, but I think overall it has made a positive impact on all hospitals, especially the rural ones, bringing them up to speed with more what the bigger teaching hospitals have already been applying. I talked to you about the safe staffing initiative because these patients are sicker. They need more intensive care. Even on the medical surgical units, there is an awful lot that these patients are requiring as far as the skill set of the staff is concerned. They really need to be able to provide that. The evidence has clearly shown that the mortality rate increases in patients 30 days out when they have had less staff. There's a higher number of nosocomial infections, pneumonia, blood clots, pressure ulcers, GI bleeding, shock, and failure to save. And that's where the RN really comes in. That RN's assessment is a very highly trained assessment of the patient. We want to catch problems before the patient really is deteriorating. And that requires a comprehensive education and a comprehensive approach to each patient, knowing inherently what they're at risk for and looking for those things and preventing them from really showing themselves. A registered nurse is best suited to do that based on their education. They prioritize your care, they execute your care, they educate you, they help transition you home by coordinating your care with the other people involved. It really feels to me, as I've worked on the nursing unit for so many years, that I have that patient's entire care in my hands. I'm coordinating with the doctors and the case managements and even pharmacies sometimes and home health care places and family members to try to get the best plan in place for you as you transition home. That's another piece that the registered nurse is really intricately involved in. With the evidence now clearly showing that the higher the number of registered nurses to patient ratio, decreases the chance of mortality and the chance of problems that can arise in the hospital, I think it's time that we act to pass this legislation to have patient ratios in place to registered nurses. I know that there's acuity scores that you've been looking at. I believe they should be incorporated into this bill. However, I do feel that minimums need to be there. I think that can also be manipulated a little bit. I think the registered nurse should ultimately have the say in what her patient's acuity levels are. I think that the educational and experience of the nurses on the unit should come into play as far as staffing goes, and also other environmental issues that can happen on the unit, like patient turnover. I think that needs to be looked at as well. If you're having 5 patients discharged and 5 new patients brought in, those new patients coming in need you to then implement their whole plan of care and do a thorough assessment on them, and they would be then more time consuming than maybe a patient that you had yesterday that's starting to trend better, which is why the registered nurse is really in the perfect position to evaluate the acuity level of the patients that she's caring for, that he or she is caring for. In the spirit of Lillian Wald, she was the founder of she was the founder of public health nursing. She says that the patient's needs should dictate nursing, ultimately, not institutional policy, because we really are dealing with individuals with very individual healthcare needs. So I would like to really continue on with that thought in mind as you look at this bill. I know that we've passed some safe staffing acts in California and other states. I really want to impress upon the importance of having those minimums in place, though, because patient conditions also can change, and what we also are looking at is the potential for problems that can come along. I want to thank all the coalitions that helped bring this to the Senate floor and all the educating that they've been doing. That would be the National Nurses United, American Nurses Association, other state nursing organizations, and grassroots patient advocacy groups, the parents and sisters and brothers and caregivers who have come and told their stories to you as well. So I feel like we've together with the evidence and the personal stories shared really what we're trying to pass here. I hope that we've educated you. I think as far as payment goes, since safe staffing has been proven in the evidence that it increases the patient's good health and decreases their length of stay and post-op and post-medical complications, and it's also decreased their return to the hospital and their 30-day mortality rates. I feel like it should be another quality indicator, and that it should be CMS reimbursing on that. If CMS reimbursement is based on this quality indicator, that means that hospitals would have to be responsible for reporting this, not only to the government, but also I think staffing should be reported publicly and in a way that people can understand. So please consider passing this. Thank you, Senator Brown, for taking it to the Senate floor. I appreciate your time.